Good morning, and I welcome you all to this teleconferencing session of PGDHHM program. Friends, you will recall that in these teleconferencing sessions we have already covered course 1, course 2, course 3, and in the last teleconferencing we were talking about some of the clinical, diagnostic and therapeutic areas, and we have covered outpatient, operation theatre and inpatient services. In this particular program, we will be covering some of the leftover areas in the course 4, and there have been requests from the students that in course 2 we have been not able to cover equipment management also. So we will be covering that portion also in this teleconferencing session. So my request to all of you will be that whatever the questions are there, please keep on shooting your questions so that the panel of experts who is here, they can answer to your questions. Before we start this program, let me introduce the panel of experts. To my left is Professor A.K. Agarwal from School of Health Sciences, IGNOU. To my right is Dr. J.K. Das. You know that he is Professor in National Institute of Health and Family Welfare. And to my extreme right is Colonel Rao, and he will be taking a session on radiation services management and radiation hazards. So without wasting any time, I will request Professor Agarwal to tell our students that what is the importance of equipment management in the hospitals, and what are the various procedures for purchasing equipment. If a learner is or if a hospital administrator is going to purchase an equipment, what are the things he should keep in mind, and then how to do the maintenance of the equipment, including the preventive maintenance or a long-term maintenance program. So I will request Professor Agarwal to tell our learners that all about this equipment management.
Thank you, Professor Arora. Welcome viewers once again, and as Professor Arora mentioned, we could not cover this subject during the last teleconferencing, and we felt that though we have moved on to the new course, that is the Clinical Diagnostic and Therapeutic Services, a discussion on the hospital equipment management is absolutely necessary, and that is why we thought that we must cover it thoroughly. We must have discussions. We can invite comments from the experts sitting on the dais here, and we would expect you to interact with us and raise questions or doubts, whatever you have in your mind. The hospital equipments actually in today's scenario assume greater and greater significance, where the clinicians in our secondary and tertiary care hospitals are increasingly becoming more modern, have become more advanced, and the care demands, the patient care and medical care demands that we use the sophisticated diagnostic as well as therapeutic equipments increasingly to help the clinician in diagnosis, to help the patient in proper treatment. But unfortunately, I would say that this subject or this entire issue of the hospital equipment management, maintenance, repair, condemnation, disposal has been neglected by medical administrators. You see, I'll blame more the medical administrators and clinicians than anybody else. There was a survey, very interesting survey, which was carried out in 1992. This was the period, by Department of Electronics, Government of India, and this survey was done under the chairmanship of the Secretary, Department of Electronics, Mr. N. Vittal. You must have heard the name of Mr. N. Vittal, the former Chief Vigilance Commissioner of India. Before moving to this portfolio of the Chief Vigilance Commissioner of India, he was Secretary, Department of Electronics, Government of India. And he, you see, it was not the Health Ministry, ironically, it was this ministry department, this department of the government, Department of Electronics, which conducted the survey in 9 states across the country, and these states include in south it was Chennai, also Andhra Pradesh. In north it was of course Delhi, Punjab, and then we had Orissa, Maharashtra. It was cutting across the length and breadth of the country, and it revealed, that as much as 40% of the hospital modern equipment in radiology, laboratory, operation theatre, ICCU, what you name, and the department. So this survey comprehensively covered hospitals in these 9 states including Delhi, and concluded that at least 40%, maybe up to 50%, they said sometimes, these equipments are lying unused, lying idle for want of simple maintenance and repair. It was not that these equipment have been condemned. That is another issue we will share with you. That after condemnation also, they are not condemned, and there is heap of equipments lying in some of these departments which I have mentioned, and occupying the precious little space that we have got in the hospitals, because all our medical administrators or HODs, they do not take proactive action to condemn the equipments, and everybody says, okay, let me retire peacefully or transfer peacefully without any audit objections, and let my successor do it. And this story repeats, one successor after another successor. So what we will discuss in this will be broadly under the 2 broad headings. We can see the monitor, and you will see on the monitor that we will discuss on 2 main items, that is the timely maintenance and repair, and the methods of condemnation and disposal. Can I ask the control room to focus the slides on the monitor, please? Yes, the discussion will focus on the timely maintenance and repair and the methods of condemnation and disposal. Now, you see, if we look at another scenario which I mentioned to you, is that when we talk of the hospital equipment management, there are some other scenarios, that is, the medical administrator should also be guided. The entire issue of the hospital equipment purchasing, maintenance and repair has to be based on scientific principles of the materials management, rather than on the instincts or experience alone. It has been said that to commit an error is human, but not to learn from our errors and commissions is inhuman. And therefore we should have certain useful guidelines, like use coefficient of the equipment. It's a kind of a rule of thumb which says that if the use coefficient of the equipment is less than 50, we should properly justify the procurement of the equipment, because it is likely to be underutilized. And the use coefficient is denoted, or is can be explained by a simple formula which has been given in your blogs. It is N upon M multiplied by 100, where N means the number of hours equipment that you are going to purchase, number of hours it is going to be or likely to be used every day, and M, the denominator, the M means the maximum number of hours that the equipment could possibly be used in 24 hours, multiplied by 100. Now suppose you have taken a decision to buy a X-ray machine. You already have one X-ray machine, say 500 MA, and you feel that the workload over the last 5-10 years has increased considerably, and the machine, one more machine need to be added. Then you have to apply this use coefficient. Suppose you when we say N, the likely hours that you are going to use it every day is say 4 hours that you say that we will be able to use additional X-ray machine. But M, the maximum number of hours that could possibly be used as recommended by the manufacturer is that you can easily use it for 12 hours a day without any much wear and tear or any such problem. Multiplied by 100, so 4 upon 12 multiplied by 100, the use coefficient comes to 33%. Okay, now as a medical administrator, you have to have a discussion detailed meeting with the head of the department. Well, my dear, you are going to use the machine very inadequately. While the company says that we can use it 12 hours a day, but you are using it only for, you are going to use it only for 4 hours a day. Now, can we reschedule the work? Can we see that some unnecessary X-rays are being taken, which can be cut down? Can we increase the working of this machine to optimally utilize with proper maintenance, repair, which can be undertaken periodically with preventive maintenance, as Professor Arora mentioned, which is the hallmark. We'll discuss that also. So you see, you can postpone the decision to purchase another machine till the time you have a use coefficient for this machine which is more than 50%. Then it is justifiable. So that is one rule of thumb when we are going to buy more machines in the same department of the same type of equipments. But remember, this use coefficient will not be applicable to certain essential and vital equipments like the portable defibrillator or ventilators. These are the things that if even they are not used 50% or more than 50%, we have to have them. We have to have not one, we may have to have more than one in ICCU, ICU, in emergency and all these places. So this use coefficient is applicable to the equipments of laboratory, radiology, etc., where we have to look into the proper utilization. So that's one guiding factor for the procurement of the equipment. The second thing is, in today's market, you have to be very careful about the type of latest, most modern equipment that you are going to buy. I mean, suppose you take it, your clinician or your imaging department expert says that I need a CT scan in the hospital, and so far you don't have any CT scan. It's a hospital which has taken a decision, a district hospital or a 500-bedded hospital in a medium city. So far you were referring the cases to outside private CT scan, but now you have taken a decision. Okay, taking a decision is fine. Adding a CT scan in a 500-bedded hospital is absolutely justifiable. But what preparations you have to do before buying the CT scan? Well, your clinician, your imaging head of the department may come and say that we want to buy the Siemens CT scan or XYZ company CT scan, and he will try to give all kinds of justifications in favor of that vendor. Never fall prey to these kind of pressures that you go by a brand name of the CT scan. I'm giving one example. What should you do then? What we have to do is to work out detailed specifications of the equipment. Okay, you buy a car. Now B segment, C segment, this segment, and then what all varieties of the car, and depending upon how much money you have, you decide to buy a B segment. In the B segment, we have got n number of cars. Then you work out, okay, the air conditioning, you work out the space, you work out the boot of the car, the dicky, work out all the specifications and requirement, and then say, okay, I am going to buy this car because it meets my requirement in terms of the specifications, and for you get the maximum value for your money by purchasing that model. And then in that you compare the various other models. You must have seen in newspapers a table comes where a set of inventory of the items on the left side, and then they tick on the other side. Similarly, CT scan. So we have to work out the specifications. As a medical administrator, I am not competent. We have to call a meeting, or we may have to constitute a committee of experts, imaging experts. We may have to invite the specifications from half a dozen of vendors, and then make a table in a tabular form: gantry, aperture and tilt, the image dissipation, sorry, the heat dissipation, image resolution, these dynamic CT frames per second, blah blah blah. And you know, these are the just examples. So we note down these specifications, and then we reach a common agreement that okay, now by having these kind of specifications, a CT scan with these specifications will buy the most modern CT scan. Then you give a tender, whether it is different types of tender, open tender, and in that you give the specifications with all other terms and conditions, including the penalty clauses, because you have to be very careful. That is another very weak spot, let me tell you friends, that giving the tender document must take some time. I won't call it a waste of time. I think that the most judicious use of time, even if it is a lengthy process. Because once you give the tender, it must have all sets, not only of the specifications, but all other penalty clauses, the purchase contract, which you can have it in the beginning or later on. But talking about the specifications, what I am trying to say, that once you give the tender in the newspapers, and then you invite the bids, and you invite two types of bids, the technical bids and the commercial bids. The technical bids are these specifications, and they will have to comply, and in that tabular form they have to submit their bids in a sealed envelope, and then also submit their commercial bids, rates, you know, whatever they quote in terms of money for that machine, that should be sealed in a separate envelope. Like that, suppose you have received from 6 or 10 vendors, and then you call a meeting of your internal officers, which should include a finance person, administrators, some clinicians, including head of the department, and then you first open. Which bids will you open first? We open the technical bids first, not the commercial bids. So we open all the vendors' technical bids and then shortlist. Okay, out of the 6, there are only 4 who are meeting the technical bids. And then you open the commercial bids only of these 4, not the other 2 who have not met. And then these 4 people that meet the commercial bids, they meet the technical bids, their rates, commercial bids have been opened, and then we prepare, okay, a table who is the lowest, L1 we call it, L1, L2, L3, L4. And then L1, when we decide, then we can place the order to L1. But while placing the order to the L1, then you can have further negotiations with the L1, that suppose he is giving you 1-year warranty. You say that we would like to have 2 years warranty, comprehensive warranty with the spare parts. You can do that. And then you can also say, give us the spare parts for 5 years. You should also put a clause that you can put in these clauses in the tender also. You can put also a clause that after the warranty is over, 2 years warranty is over, or 1-year warranty if they are very adamant on it. After the warranty is over, that you will enter into the annual maintenance contract for the next 5 years at this price with annual incremental increase, you see. And that also we should, before we buy that equipment from that vendor, we should try to verify the antecedents of the vendor. Where have they supplied this equipment before? Get a letter from there. Are you satisfied from them? I mean, we have to be extra careful. You are investing 1 crore of rupees to buy that equipment. And if it is your private hospital, you can imagine the money that you are going to take on loan from the banks, on which you have to pay interest through your nose. Then you have to break even also. And if you land up with the equipment which is you are cheated on more than one fronts, then you are in soup. So these are some of the things in the equipment scenario that we have to keep in mind. Now, can we have slides on the monitor, please? As we said that we will discuss this on the timely maintenance and repair and the methods of the condemnation and disposal. Sorry. Now, maintenance of the equipment has to be based, as you know, the hospital equipments are based on sophisticated and high-cost technology, which involves huge funds, and therefore the maintenance has to be discussed threadbare, and we can discuss this maintenance under three broad headings. One is what is the existing situation with regard to the hospital equipment? What should be the outline of the plan of biomedical engineering operations for maintenance? And then the master maintenance plan. The existing situation of the hospital equipment, as I described and as that survey described, is really very, very gloomy. Hospital equipment seldom have 50%, 40 to 50% of them in usable conditions. Most common factors for this wastage are listed here. That the equipments are sometimes underutilized or never used due to lack of the expertise, and the reduced lifetime of the equipment due to mishandling. The extra workload of the hospital. Sometimes we have extra workload in the hospitals. Downtime of the equipment is increased due to the lack of the preventive maintenance, lack of the spares and the inexperience in the repairs, and the resource constraints. Now, outline of the plan of biomedical engineering operations. So you see, this is the existing situation which we have already discussed in brief. Now, how can we go about the maintenance and repair? What should be the important things when we decide about the outline of the biomedical engineering operations of the equipment? You see, we can discuss this under four elements, this biomedical engineering plan. First thing is the requirement of the equipment. You see, as we have discussed, the requirement of the equipment has to be realistic. You should buy equipment only when you need it. Apply use coefficient. I know of a hospital. It was a small 100-bedded hospital in Delhi only, and since it was a government hospital, and since they were left with some money at the end of the financial year, in the month of January, they had a lot of funds which were to be utilized. They didn't bother about the utilization all through the year, and then suddenly they decided, oh, we have got so much of money, let's go and buy a lithotripter. And this was way back in maybe I think 20 years back, when the lithotripsy came into fashion, or came into existence, not fashion. It was introduced as a kind of a non-invasive method of removing the renal stones, renal calculi, etc. So the hospital went ahead, bought the lithotripter. The machine came, in nice packing, and they offloaded the machine, and the payment was made 90% or so immediately. And then they realized, oh, the hospital does not have a urologist. Who is going to operate this machine? It cannot be used, you see, by any surgeon or by anybody who is not a urologist, or a surgeon who has not been trained, given an advanced training in urology or nephrology and all these things, particularly urology. So this was kept in the hospital unopened almost 9-10 months. They realized that the warranty is going to be over, and then there will be serious audit objections. There were high-level discussions in the government, and they shifted the lithotripsy to the teaching hospital under the same government in Delhi. We have a lot of governments in Delhi, We have the Delhi government, we have the central government, then we have the municipality of Delhi, which is very big, then we have the ESI corporation, so many which comes under the labor ministry. Okay, I'll not name the department where this happened, or the hospital where this happened. So this was shifted to a teaching hospital where the urologist was there, and in this process the warranty was over. And then there were a lot of problems in installation, in commissioning. They had to pay hell of a lot of money in its commissioning. And so this is what this means, that the demand has to be realistic. Let's go back to the monitor and see, that when we buy the equipment, we must be, sure that it is going to be properly utilized. We have the competencies, expertise, and then we identify the equipments and assess the quality of the equipment, decide on the specifications and the sources. How big is your hospital? What are the types of services being provided? Workload in terms of the patients, the workload of inpatients, the outpatients, and ICU would help in assessing the requirements. How much budget do you have? Just because you have the money, you should not buy equipment, as I gave you one example. And whenever we buy these high cost, sophisticated equipments, we have to keep in mind that we include the expenditure on the maintenance, the annual maintenance contract. Many a times the warranty is over and we have no money for its annual maintenance. Fourth is the preventive maintenance. This is the hallmark of the hospital equipment management. And preventive maintenance is well said as a stitch in time saves 9. It's a very famous British saying that a stitch in time saves 9. I don't have to explain this. But the preventive maintenance can be discussed a little more, that it has innumerable advantages. Again, giving example of the motor car, we have a we buy the cars, and when we buy the new car, they give you 3 free services normally, sometimes more, but 3 is guaranteed. And after that, warranty is over. Then, periodically we take it to the garage for servicing, for oil change, for filter change, for various things, washing, cleaning, etc. And then, our car keeps on running for a longer time. Same is true for the hospital equipment. Are we really that serious about its preventive maintenance? Many times we are not. But if we are, then you get these advantages which are listed here. Number 1 is the reduced idle time. Number 2 is the increased life of the equipment. Third is the optimal operational cost. Can we see the slides, please? Can we have the slides? So, reduced idle time, increased life, continued service, optimal operational cost, satisfactory service, and safety of operations. When getting the equipment, we have to also take care that we try to extract longer warranty, and the spare parts are also taken, which can last you for some time, rather than that we don't ask any spare parts from them. And then insert the penalty clauses in the purchase contract, that if you do not turn up within, say, 24 hours, if you are a little away from big city, that if your X-ray machine, if your CT scan is down, and once you call them, they must be there as early as possible, or you can define time, say 24 hours, and if they don't come in 24 hours, you can put the penalty on them. We don't do these things. That is why we are taken for a ride. And most of these equipments are, high cost, sophisticated. So they, we should go for, especially for the equipments in intensive care unit, OT, etc. That area should have a voltage stabilization, or we should have uninterrupted power supply systems, like, we get the UPS with the computers these days, which we have in our offices. Similarly, we should have heavy duty UPS to give us a constant uninterrupted power supply, voltage stabilization, and then we should have a 3-grid supply. In case one grid fails, we can switch over to the second, third, so that we have continued supply without any fluctuations or changes. The master maintenance plan, again Professor Arora gave mentioned about this. The master maintenance plan is something which is a long-term. Master maintenance will include the short-term as well as the long-term plan. The short term would mean recruitment of the skilled manpower, establishing the spare parts bank, training program on the maintenance and repair. And the long term plan would mean that any hospital of the size of a district hospital and more must have a workshop of its own. You can call it a maintenance organization in the form of a central organization, central cell for the maintenance and repair, which should be headed by a trained technician, if not an electronics engineer. We should have a foreman or the electronics, biomedical engineering trained people, biomedical engineer in larger hospitals, and there should be good communication between this cell and the seller of the equipment, the vendor. And this cell should be able to follow up the maintenance and repair service, and should also establish proper documentation, good records of the purchase. And then this regular training teaching programs must be carried out for the technicians as well as the doctors. Is there any question, Dr. Arora, on this?
Yes, you just try
Yes.
to finish, so that there is one question from Rajasthan that I will be asking.
Okay, so I will first finish it, then you can ask, you can reply that question. So regular training teaching programs are extremely important, because we don't have these training programs. Dr. Das will bear us out that in Dr. Guha in IIT Biomedical Center, we were in touch with him, and we thought that we should try to design a training program for the hospital technicians, but somehow it didn't proceed further. So the IITs are best suited for this training, or we can have any other organization. Last part of this presentation is the condemnation and disposal procedures. For example, there are number of equipments which have outlived the life, or which have become unserviceable because of their beyond economic repairs. So for such equipment, we must also be able to condemn them, do the condemnation and dispose them off. For this, it is it will be very efficient if we develop a history sheet. A history sheet of the equipment is a very important document which must be maintained, especially for the costly equipments like X-ray machines, the laboratory equipments and other ventilators, all these things. So the history sheet will carry the data on all these aspects: identification data, make, model, date of purchase, details of the suppliers, availability of spares, the purchase cost, breakdown, repairs undertaken and the expenditure incurred. Expenditure is important so that we can justify its beyond economic use, because a equipment may be repeatedly being repaired and you are incurring huge expenditure. Again it breaks down. You can justify that during last 1 year the AMC was this much. Beyond the AMC, because AMC does not replace the parts, they come and do the repair, and if there are any spares, you have to pay extra. So you can, if you have the history sheet, if you have the proper documentation, you can tell that during last 1 year we have spent huge amount of money, and therefore this machine is now obsolete, as well as it's beyond economic repair, and therefore it should be phased out. And then this is one way. If you have the history sheet, you will be able to justify its quick condemnation and disposal. Now this is the a format of the history sheet. We can design for all costly equipments, which gives the details as mentioned here: the name of the firm with the address and telephone number, who are the local servicing agents, how much have you bought one X-ray machine or two, what was the cost at the time of purchase, when did you receive it, when did it break down, all the how often it is breaking down. And then one more column here: how much have you been spending on its repair and maintenance, when was it repaired. Remarks you can write whatever you feel like, important things including the life of the equipment. Besides this, we can also maintain a log book of the maintenance and repair, which gives you some of this information. Logbook, history sheet and logbook can be one integrated document in which all the details will come about how much expenditure is being incurred on its maintenance, etc. I think I will stop here, Professor Arora, and I would request you, whatever doubts you have, whatever experiences you have, you must share with us. Thank you.
Thank you, Professor Agarwal. I think you have very nicely covered that what is the importance of having equipment management systems in the hospital, and how these need to be maintained and how they have to be condemned. Sir, we have got one question from Dr. Mahesh Hemandani from Abu Road, Rajasthan. He has asked two questions. One is what is downtime of equipment, and second is what are the different criteria in selecting second-hand equipment for the hospitals.
Okay.
If he wants to purchase second-hand instruments, equipment for the hospital, so what are the criteria, what are the things which we have to keep in mind?
That's a very good question, Professor Arora. Downtime is simple. Downtime is the time when the equipment is not functional. That is a breakdown. Until the time the equipment is repaired and starts functioning again, this gap is called as downtime. And we have to minimize the downtime by having good preventive maintenance and then good backup annual maintenance contracts, so that immediately the technicians from the vendor, they come and repair it. So that the downtime is actually the time when it is not in use. And the second part of the question is that what should be the criteria for the purchase of the second-hand equipment. I think yes,
same criteria. Same criteria. Only thing, but we have to see that whether when we are purchasing second-hand equipment, whether the spares are available or not. What is the condition of that particular equipment?
Exactly, and also the whether it meets your specifications. You see, you have to again go back to the specifications, that it meets your requirement. And those, it should not be, though it is a second hand, you can get a good price as we get for the cars again, but you have to see that it is in good order, it can last you. You have to get it assessed by the technical people, the biomedical engineers should be, and some experts besides the doctors, the technicians. We may have to take help of the engineers. I will invite some other comments.
More than that, it should fulfill your requirements, whether it is fulfilling the requirement of that particular hospital. Dr. Das and Dr. Rao, would you like to?
Yeah, maybe. Rao, you can go ahead, then I'll.
There is a practice in the Western countries to transfer their used equipment to the developing countries. This has been a practice, especially for the poor countries. The equipment is donated by the Western countries. But the caution is this, that again, as Professor Agarwal pointed out, that we must check it by a service engineer who is qualified biomedical engineer, and that particular equipment has to be checked for its utility, its life, and how much maintenance would it require later on. And the availability of the spares also has to be guaranteed by the person who is transferring that equipment. That I feel.
I think I did a study for drug equipment and supplies for CMI systems. As you are mentioning that they were donated, they were getting some equipment by donations from the other institutions. And the same problem what we are telling, they were lying ideal because there were no spare parts and the technology was obsolete and the spares were not available. And that's why they could not utilize them. Although they were existing, but they were not able to utilize. Professor Das, would you like?
Yes, and moreover, sometimes in your own organization also, you may not be having that kind of provision. So whenever you are going for it, ensure that your organization is having the proper provision to maintain for its maintenance. Maybe it's annual maintenance or comprehensive annual maintenance, whatsoever it may be. And second thing is, it will be better if you can have the tie-up with the same supplier or the same manufacturer of that equipment, and let them ensure that they will be taking care of or looking after for that period of this. Otherwise, just going for it, buying it may not be, a very good thing to do. Yes, Professor.
Any other questions from other regional centers? If there
I would just say one more thing. In the hospital equipment management, some new concepts are coming. Suppose as we discussed about CT scan, the lean.
Yes, Jabalpur, please come up.
Hello. Yes.
Good morning.
Good morning, sir. I am Dr. Tiwari from Jabalpur.
Yes, Dr. Tiwari. What is your
I would
question?
like to know, is there any quota life for the specific instrument?
Yes.
Yeah,
The
that's it.
life.
Yeah.
Yes, you see in the history sheet, Dr. Tiwari, we mentioned a column can be inserted about the life of the equipment. Now, let me give you one example. When you buy the ambulances or the staff car in the government departments, you know, Army, Navy, or in central government, state government, a staff car has a life of 15 years or 1,50,000 kilometers. I mean, in this case, both the parameters have to be filled, that the staff car should have run for 15 years and should have run for 1,50,000 kilometers, and that is the life. After that, you can phase out the staff car. Similarly, we can ask the suppliers to give us that, okay, the X-ray machine will last us for 5 years, 7 years, and then after that, we need to, you know, upgrade it, or we need to phase it out and buy the most modern machine. So the life of the equipment should be determined, and then that will help you in condemnation of the equipment. The point that Dr. Arora, I just want to say in 1 minute, half a minute, is that you know, very sophisticated, high-cost technology like linear accelerators, MRIs. Now there is a concept of turnkey installation. You know, there are companies, Siemens, BPL, which take this work on turnkey basis. Turnkey means that they will take the all civil, mechanical, electrical, you know, and then it will be more expensive, but they will come, you give them the land space that here we want to install the MRI or the linear accelerator, and then, you know, they will come and do the civil, mechanical, electrical work, install the machine and commission it, and then give the completion certificate, you can start using it. That is the turnkey basis, which saves the botheration, and many a times there are a lot of delays because of this.
Would you like to add something?
Thank you.
And Colonel?
Yeah, actually, total life of the medical equipment is around 7 to 10 years, especially the costly equipment like your CT scan, MRIs. You can actually make out the life of equipment from the thing that which manufacturer gives you, that this much is the AMC is possible for 5 years or 7 years. That itself gives you a clue to how much is the life of the equipment, because beyond that it will be very, very uneconomical for a manufacturer to give the spares as well as to give the maintenance warranty. That is my view.
Thank you, Colonel Rao. I think we have to wind up at this particular time, because the time is over, and we'll be back after 15 minutes of break, and then we'll be covering some of the clinical areas of the course 4, that is laboratory services, then radiodiagnostic services and the laboratory services. So we'll back after break, and then we'll discuss these topics.